Kia ora everyone, this is almost everything you'll need to know about the hip bone or innominate bone. This is what the hip bone looks like with the femur stuck on it, articulated. And the first view we'll consider of the hip bone will be this anterior view. Ta-da! The hip or innominate bone is actually comprised of three bones which fuse together. The three bones are the pubic bone, the ischium and the ilium. And when they fused together, nobody knew what to call it, so it became the innominate bone, the bone with no name. Later on, the name's been changed to hip bone, but the hip is a joint, not really a bone, but that's what we're left with. So to separate the hip bone into its three bones, we'll draw a line sort of through here, and one through here, and this is the pubic bone. It contributes just a little bit to the acetabulum. And then if we separate the ischium from the ilium, something like that, this would be the ischium and this is the ilium. So features of the pubic bone that we can see here. This is the body of the pubic bone, this most medial part. That has been changed a bit over time, so you may find in some books or atlases that the body was considered the part that contributes to the acetabulum, the more lateral part here. But this is the body now. This is the superior pubic ramus, and this is the inferior pubic ramus. The superior pubic ramus is relatively more interesting. It features this tubercle of the pubic bone, and the posterior edge of the top of the superior pubic ramus is a rough area here, which is called the pecten pubis. Pecten meaning comb-like, because it's spiky. Where the superior pubic ramus flares out to join the ilium is called the iliopubic eminence, this area. There's a symphyseal surface medially here where the pubic bone attaches to the symphyseal cartilage, and then that attaches to the neighboring pubic bone. This area here, which carries the symphyseal surface, is known as the crest of the pubis, especially when it's mated with its neighbor. The ischium is this area here. It has a body, which is the part that has the acetabular surface in it, so the part that contributes to the acetabulum, which is the socket for the head of the femur. This is the ischial ramus. It only has one ramus, and it joins with the inferior pubic ramus, and together they're called the ischiopubic ramus. We can't see it here, but there's a very bold tuberosity of the ischium, the ischial tuberosity. We'll see that in another view. The ischium and the pubis together form the obturator foramen. Obturate means to close. So this is literally the foramen that is closed, and it's closed by a strong obturator membrane that almost completely closes the obturator foramen. There's a little hole in it for the obturator nerve to pass through, and that's a very nice nerve that goes to the adductor compartment of the thigh. Finally, we have the ilium, which is the remainder of the hip bone. It has a body, which again is the part that contributes to the acetabulum. You can see why they wanted to call the part of the pubis that contributes to the acetabulum the body. That would mean all three bodies of the bones would contribute to the acetabulum, but that was deemed not to be. Anyway, body of the ilium contributes to the acetabulum. It's this area here, and then this huge wing is the alar of the acetabulum, and alar means wing. The very top of the wing is flared into this bold crest, the iliac crest. The iliac wing, this is the pelvic surface here. It is known as the iliac fossa. The crest ends anteriorly at the anterior superior iliac spine, this pointy bit, and just below that there is another spine on the ilium, which is the anterior inferior iliac spine. This means that there'll be a posterior superior iliac spine and a posterior inferior iliac spine. Again, we'll see those better in another projection. We'll look at the pelvic surface now. So we can see here the body and inferior ramus of the pubis, the superior ramus ending here in the iliopubic eminence, and the symphyseal surface. The ischium, we see the body here. This very pointy ischial spine is a prominent landmark, and that separates this notch here, this comma-shaped notch, which is the greater sciatic notch, from the smaller, lesser sciatic notch. The ramus of the ischium here joining with the inferior pubic ramus, and we see the body of the ilium, this part, and from the pubis there's a line that extends across the body, separating the body of the ilium, I guess, from the alar, and that is the arcuate line, and it denotes the separation of the false pelvis, this upper area bounded by the iliac fossa, from the true pelvis, which is the area below the arcuate line. Now we can see the anterior superior iliac spine and the anterior inferior iliac spine. This doesn't have a name as far as I'm aware. The iliac crest ending in the posterior superior iliac spine and the posterior inferior iliac spine here. This rough area is for the fibrous part of the sacroiliac joint. It's called the tuberosity of the ilium. And this smooth area is an articular surface also for the SI joint, which is a compound joint. It's partly synovial through this surface, which is the auricular surface, because it looks a little bit like an ear shape, and this fibrous surface here, which is very rough, the tuberosity. Finally, we'll look at a posterior view. So we can steer here into the acetabulum, which means little vinegar cup. The acetabulum is very round to accommodate the head of the femur. The articular surface here is called the semilunar surface, for obvious reasons. The non-articular area is the acetabular fossa, and the notch below that is the acetabular notch, where the rim is incomplete. See here the iliopubic eminence and the pubic tubercle once more, the body of the pubis, inferior pubic ramus. Now we can see the very bold, roughened ischial tuberosity. That's the bit that you sit on, ischial ramus, and the body of the ischium, featuring the ischial spine. Again, greater sciatic notch and lesser sciatic notch. The ischium and the ilium are separated about here in the middle of the greater sciatic notch. So the pubis contributes about 1/5 to the acetabulum, and the ilium about 2/5, and the ischium about 2/5. Again, in the ilium, the body and the wing, or alar. If we look carefully, you can see a line here, so this is the gluteal surface, the lateral surface of the alar of the ilium. And if we look carefully, we see here a posterior gluteal line. And behind this is the attachment of gluteus maximus. There is an anterior gluteal line here, and in between those two gluteal lines is the attachment of gluteus medius, and there's an inferior gluteal line, so posterior, anterior, and inferior, and in between the anterior and inferior gluteal lines is the attachment of gluteus minimus, and the remaining area below is bare. In the iliac crest, we can see that there is an external lip here and an internal lip on the other side. The area in between is called the intermediate zone. Where it's widest here is the tubercle of the ilium. The tuberosity was the rough area for the sacroiliac joint on the pelvic surface. This is the tubercle. And again, we see the anterior superior iliac spine, anterior inferior iliac spine, posterior superior iliac spine, posterior inferior iliac spine. If we look at the two hip bones, there are two here, in their anatomical position, we see that it's tipped a lot further forward than most people imagine, and the pubic crests are in the same vertical plane as the anterior superior iliac spine. And this means that the ischiopubic rami here actually are quite horizontal. Well, not really, more horizontal than people think, and actually act as a floor to help support structures in the pelvis from falling out, and also help support the weight of the abdominal contents above the pelvis. This means that the pelvic outlet here actually faces more backwards than straight down than most people imagine. Both hip bones join together medially and with the sacrum here. In here we can appreciate that the false pelvis is the bit above this arcuate line that's cradled, if you like, by the iliac fossa, and the true pelvis is this area below where the true pelvic contents lie. That would be the bladder, whatever internal reproductive organs you have, and the rectum. Look posteriorly here at the joined pelvic bones, hip bones, and again, seeing that the level of the tip of the coccyx here is at about the same horizontal level as the pubic tubercles, pubic crest. So the whole thing tipped quite dramatically forwards. Also want to show here the ligaments that close the sciatic foramina and change them from sciatic notches to sciatic foramina. There is a sacrospinous ligament, so from the sacrum to the spine of the ischium, like so, which helps to close off the greater sciatic foramen. And there's also a sacrotuberous ligament, let's say like this, that helps to close off the lesser sciatic foramen. So here the greater sciatic foramen, here the lesser sciatic foramen, and these foramina are not closed, and they transmit structures that arise in the pelvis to the lower limb, and also from the pelvis to the gluteal region, and in the case of the pudendal nerve, back towards the pelvis in the perineal region. So greater and lesser sciatic foramina from the greater and lesser sciatic notches closed by the sacrospinous and sacrotuberous ligaments. Here's a more professional rendering of those structures. So that's almost everything you need to know about the innominate bone, hip bone. I think I called it pelvic bone in there at some point. There's more details in your book, but if you can efficiently name those structures that we've illustrated here, then you'll be doing great. Next time we'll move on to the femur. Until then, ka kite.